On average, someone has a stroke every 40 seconds in the United States. Stroke ranks number 3 among causes of death, behind heart disease and cancer. Knowing the signs and symptoms of stroke and knowing where you can receive advanced and efficient treatment can save your life or that of a loved one.
Because stroke is painless, it's important to recognize the symptoms of stroke, and that is typically unilateral body symptoms, one side of the body, either weakness of the arm or leg or both. A facial droop is a very common finding.
I was washing the dishes and my hand sort of went kind of weird, and I said to my husband, "What's this?" And he just said, "I don't know." And so I went back to the dishes in the sink and I couldn't even feel them. And so again, my hand was still in the same position. I said, "What's going on?"
And then I looked up at her and I could see that the right side of her face, she was only talking out of one side of her mouth. She wasn't talking out of the right side of her mouth. And so I went over to her and I said, "Oh my goodness," I said, "this doesn't look right."
And by then he could evidently see that my face had started to droop on one side, and so he helped me over to the bed and then called 911 immediately.
Carolyn Topper and her husband were visiting the area from Massachusetts. The decision to call 911 for an ambulance may have saved Carolyn's life. She was taken to Eisenhower Medical Center, where the acute stroke team took quick action.
After about an hour and a half, I heard a cheer come up from the room. You've got the most magnificent team of people working, because they worked so hard to try to dissolve that clot. It's like having an ice cube and putting this TP or putting warm water around it, because you can't really break it up because you don't want it to go elsewhere. You really have to let it melt, as it were, and go through. And so, but I heard the cheer, and I felt so terrific when I felt it. And of course, Dr. Ellie came in immediately, and he had a smile on his face. He says, "We got it all."
It was evidently in a very major place where, had it not been done and done well and properly and quickly enough, I would probably, be in a wheelchair or died. I don't know. I mean, I don't want to think about it, obviously, but they did such a good job. I never, as I said before, I was never in pain or fear or anything.
Stroke is a disease that affects the blood vessels that supply blood to the brain. A stroke occurs when a blood vessel that brings oxygen and nutrients to the brain bursts or is clogged by a blood clot or some other particle. Because of this rupture or blockage, part of the brain doesn't get the blood and oxygen it needs.
Stroke is a generic term, but there are many causes for stroke. Stroke in its most basic form is when a portion of the brain dies. Small or large, it's still a stroke. Often the clinical presentation is unclear as to the cause. That's why we use angiography, MRI, CT. The different imaging modalities allow us to pinpoint the cause.
Effective treatment of a stroke requires the use of various imaging technologies, which allow physicians to quickly determine which part of the brain is affected by the stroke. Stroke patients are generally awake during treatment and often begin to show signs of full recovery during treatment as the physician removes the blockage that has inhibited blood flow in the brain.
Imaging has been really the key to our success here in terms of the outcomes of our patients. Nearly 60% of our patients are living self-sufficient lives, many of those normal. Actually, quite a percentage of those are normal on the table. So we see very dramatic results, and we owe a lot of that to the magnetic resonance imaging, which allows us to actually see how much brain has died and what amount of brain or quantity of brain is at risk for dying.
Eisenhower Medical Center was the first hospital in Riverside and San Bernardino counties to be designated a certified primary stroke center.
When we started stroke here at Eisenhower 12 years ago, it was basically just me and a few other folks, but since that time, stroke has become something that the nation is aware of. We have national credentialing for that now. We're an approved stroke center, and part of the team is neurologists 24/7, imaging, interventional neuroradiologists 24/7. So we have every facility that's required, every individual skill that's required to assess any patient at any time, and no matter what time you come in, you're moved through as quickly as possible because time is brain.
Caring for a stroke patient doesn't end after the acute stroke team has performed the primary treatment. Eisenhower Medical Center has specially trained staff on a floor dedicated to post-stroke care.
Part of the acute stroke team is also the aftercare, and that's vital, of course, and we have a specialized team, we have a specialized unit with nurses and doctors who are trained in the not only the acute rehabilitation but also the long-term, so that we take you from beginning to end to give you the best possible opportunity for self-sufficient life after your stroke.
While strokes are more common among people over the age of 60, a stroke can happen to anyone at any age. Knowing the signs and symptoms of stroke can save a life.
Well, I'm not old enough to have a stroke. I'm only 40 or 50 or 60. We've had many patients in their 30s and 40s and 50s, and the reason is because stroke has many causes. The typical atherosclerotic or hardening of the vessels or heart disease causes that lead to stroke typically happen in the elderly population. However, given the many different causes, we get lots of young people who have a stroke. And as a result of that conception, many young patients who are having strokes or TIAs really don't put it together. And it's a high-risk area.
I would tell my friends and anyone who's ever out here that Eisenhower is the place to go to have any kind of procedure done, or if emergency or whatever needs to come here. It makes sense. It makes sense. You've got such a fantastic campus here. You can get lost in it. You've got a building for every known disease that's around. So it really is a wonderful place. Absolutely.
Next, Eisenhower is one of only 5 centers in the United States participating in a stroke recovery study. Find out the latest techniques being used to help victims of stroke.